I'm reporting today on Miss Tina Jones. She's a 28-year-old female patient in no acute distress. She's alert and oriented. She presents reporting a recent fender bender, and she's complaining of headache and neck pain. The accident was 1 week ago, and her symptoms began 2 days after the accident. Her headache pain is in the crown and the back of her head, and she also is experiencing muscle soreness in the back of her neck. The pain does not radiate anywhere. The headaches usually last about 1 to 2 hours, and her last headache was yesterday afternoon. She reports the headache pain as a dull ache. They're not cyclic, they do not occur in clusters, and they're not rapid and crescendo. She denies any associated symptoms with the headaches. She reports the pain feels worse when she moves her head or neck, and her symptoms improve with rest and Tylenol. She denies trying any home remedies for the headache. She reports daily headaches since the accident, and she rates her current pain as a 3 out of 10, and the worst it's ever been is a 4 out of 10. Her medical history is unremarkable except for the increased Tylenol use since the accident, and she denies any head trauma, history of migraines, or seizures. Her social history, she denies any alcohol or drug use. Her review of systems is unremarkable except for the patient reporting worsening vision over the past few years, but these changes are not acute. She says that her vision just gets blurry after she reads for a long period of time. Upon physical assessment, her head appears normocephalic, her cranial nerves are all intact, her pupils are equal, round, and reactive to light and accommodation bilaterally. Her neck has full range of motion, her gait is steady, and her sensation is intact. Upon assessment, I would classify this as an acute post-traumatic headache related to a motor vehicle accident. As for the plan for her, I would suggest having her continue monitoring her symptoms and report any worsening pain or headaches to us. She can take 800 milligrams of ibuprofen every 8 hours as needed for the next few days. She can apply ice or heat to help alleviate her symptoms as well. Stretching might help with her neck pain. And she should call the office for any worsening headaches, changes in vision, hearing, consciousness, or if she starts having nausea and vomiting associated with the headaches. She should also report any new onset of numbness, tingling, or paralysis. And then if her headaches do not subside, I would recommend the patient calling back in a couple days, and we can look into ordering a CT or MRI scan to evaluate further.